To continue with our lecture, previously we have discussed how epidemiology has evolved throughout history. Now let's discuss community reactions. Community reactions towards disease is measured by epidemiology, as what you have seen in the earlier part of the lecture or in the previous session where we presented the epidemiologic data about COVID-19. No? Both local, no, national, and global. Now, community reactions actually refer to the sum total of the reactions of individual comprising the group immunity. It usually depends on herd immunity, exposure or contact rate, and the elements of chance. Herd immunity is the immune level of the group, no, or the community. Herd immunity occurs when a large portion of a community or the herd becomes immune to a disease, making the spread of disease from person to person unlikely. So, as a result, the whole community becomes protected, not just those who are immune. And there are two paths to herd immunity. For example, in COVID-19, no, for COVID-19. Usually, the two paths to herd immunity for COVID-19 are vaccines and infection. So, for vaccines, a vaccine for the virus that causes a disease, like for example, in the case of COVID-19, would be an ideal approach to achieve herd immunity because vaccines create immunity without causing illness or resulting complications. So, herd immunity makes it possible to protect the population from a disease, including those who can't be vaccinated, such as newborns or those who have compromised immune system. So, using the concept of herd immunity, vaccines have successfully controlled deadly contagious diseases such as smallpox, polio, diphtheria, rubella, and many others. Now, another path to herd immunity is through the natural infection. So, how is it done? Herd immunity can be reached when a sufficient number of people in the population have recovered from a disease and have developed antibodies against future infection. For example, those who survived the 1918 flu, no, the influenza pandemic, were later immune to infection with the H1N1 flu, which is a subtype of influenza A. So during 2009 to 2010 flu season, H1N1 caused the respiratory infection in humans that was commonly referred to as swine flu. However, there are some problems, no, with relying on community infection to create herd immunity to the virus that causes COVID-19. First, it isn't yet clear if infection with the COVID-19 virus makes a person immune to future infection. So, herd immunity as a path to protect people, no, from COVID-19 in the future may still be in question with COVID-19. Now, the next is exposure or contact rate, no, or the opportunities for progressive transfer or transmission of the agent to new host, which is also influenced by the size of the reservoir of infection, the readiness of transmission, no, to the population, or the standard of hygiene density of vectors or the infectivity of the agent. Okay, elements of chance is also can also affect the community reactions. Now, what are the types of community reactions? We have endemic, which is the constant presence of a disease of an infectious agent in a geographical area. Sporadic, which means that the disease is appearing from time to time, and epidemic is the outbreak of illness in a community or area in excess of the normal level spreading from the common source. And of course, the pandemic, like the COVID-19 pandemic right now appearing in large region. So the amount of a particular disease that is usually present in a community is referred to as the baseline or endemic level of the disease. So, because it is usually present at that number. Okay, so the level is not necessarily the desired level, which may in fact be zero, but rather it is the observed level, no, the usual observed level. That's why it is called endemic. Now, in the absence of intervention and assuming that the level is not high enough to deplete the pool of susceptible persons, the disease may continue to occur at this level indefinitely. Thus, the baseline level is often regarded as the expected level of the disease in that particular area. Now, while some diseases are so rare in a given population that a single case warrants an epidemiologic investigation, like for example in the case of rabies, plague, or polio, other diseases occur more commonly so that only deviations from the norm warrant investigations. All right. Now, sporadic refers to again as to diseases that occurs infrequently and irregularly. Okay, as opposed to endemic, that is the usual observed level of occurrence. But with sporadic, the occurrence of disease is infrequent or irregular. Uh, okay, while there is also what we call hyperendemic, which refers to persistent high levels of disease occurrence. No, so the usual occurrence of disease in that particular geographical location is higher than is usually of higher levels. Okay, so we call them hyperendemic. No, so occasionally the amount of disease in a community rises above the expected level. Okay. Now, epidemic is, as we have said, is the outbreak of illness. So it refers to an increase, often sudden, in the number of cases of a disease above what is normally expected in that population, in a certain geographical location. So outbreak carries the same definition of epidemic, but is often used for a more limited geographical location. Cluster refers to an aggregation of cases grouped in place and time that are suspected to be greater than the number expected, even though the expected number may not be known. While pandemic, on the other hand, refers to an epidemic that has spread over several countries or continents, usually affecting a large number of people. Epidemics occur when an agent and susceptible hosts are present in adequate numbers, and the agent can be effectively conveyed from a source to the susceptible host. More specifically, an epidemic may result from a recent increase in amount or virulence of the agent, or the recent introduction of the agent into a setting where it has not been there before, or an enhanced mode of transmission so that more susceptible persons are exposed, or maybe a change in the susceptibility of the host response to the agent, and or factors that increase host exposure or involve introduction through new portals of entry. Okay, so understanding the different types of community reactions also entail understanding of the relationship that is happening between the host, the agent, and the environment, which is also part of the epidemiologic triad that we will be discussing in the succeeding topics. Okay, but before we proceed to that, let's have an exercise first of the community reactions. So for each of the following situations, identify whether it reflects sporadic disease, endemic disease, hyperendemic disease, pandemic disease, or epidemic. So for number one, there are 22 cases of legionellosis occurred within 3 weeks among residents of a particular neighborhood, usually 0 or 1 per year. So what do you think? What do you think is the occurrence? How will you describe the occurrence of that disease, in that particular community? Number two, the average annual incidence was 364 cases of pulmonary tuberculosis per 100,000 population in one area, compared with the national average of 134 cases per 100,000 population. So how do you describe the disease occurrence in this area? And then number three, over 20 million people worldwide died from influenza in 1918 to 1919. Okay. Number four, a single case of histoplasmosis was diagnosed in a community. So what is that? And number five, about 60 cases of gonorrhea are usually reported in this region per week, slightly less than the national average. Okay, so I'll give you a few seconds to think about it. Okay, so we're able to answer. Now let's look at the answers to this exercise. Okay, so for number one, wherein there are 22 cases of legionellosis occurred within 3 weeks among residents of a particular neighborhood, the answer is epidemic, because there are sudden uh, increase in number of legionellosis occurring within the period of 3 weeks among the residents. And that's quite a significant number already. Number two, the average annual incidence was 364, while the national average is 134. So that seems to be a description of hyperendemic disease. Although the pulmonary tuberculosis is usually observed in that certain area, but the number of cases is higher than usual, no, than the national average. Okay, so that's a hyperendemic disease. For number three, it's very clear, just like what is happening right now for COVID-19, no, there is a pandemic. And for number four is uh, the single case of histoplasmosis, no, uh, is described as a sporadic occurrence. And for number five, about 60 cases of gonorrhea are usually, the term usually reported in this region per week, slightly less than the national average, is an endemic occurrence. Okay, so I hope that the community reactions, different community reactions to a disease, or the disease occurrence in a certain community is very clear to everybody. Okay, now a community health nurse should understand, the basic epidemiologic concepts. Uh, as we have discussed the different community reactions, you might have encountered, certain concepts that needs to be understood very well. So you can describe those community reactions and also gather the appropriate epidemiologic data needed. Okay, and these basic epidemiologic concepts includes the epidemiologic triad, both in descriptive and analytic epidemiology, and also the concept of disease occurrence and the natural history of disease or illness, as well as the levels of disease prevention as intervention, and the epidemiologic investigation. So, epidemiology, rests on uh, these important concepts. But before we proceed, we need to understand the different epidemiologic approach. And there are four. No? So first we have descriptive epidemiology, wherein it is concerned with disease distribution and frequency, that answers the questions who, where, and when. And when we talk about analytical epidemiology, it attempts to analyze the causes or determinants of disease through hypothesis testing. And it answers the question, how is the disease caused and why is it occurring? So that is analytical epidemiology. Okay? And also another approach is the intervention or experimental epidemiology that answers questions about effectiveness of new methods for controlling diseases or for improving underlying conditions. And of course, the evaluation epidemiology that attempts to measure the effectiveness of different health programs. Now, usually the investigations, epidemiologic investigations, go through these process. No, so as we said, we start with the descriptive studies, and then we generate hypotheses, and then we test this hypothesis by conducting analytic studies, whether and then we test this hypothesis through the experimental studies, then later modify those hypotheses depending on the outcome. Okay, so this is usually how the process is going on. To understand more or to elaborate some more, there are two broad types of epidemiology, the descriptive and the analytic epi. So as we have mentioned a while ago, descriptive examines the distribution of disease in a population and observing the basic features of its distribution in terms of time, place, and person. So we try to formulate hypotheses, look into the association, and the typical study design for descriptive epidemiology are community health survey, no? Which is also called a cross-sectional study or a descriptive study. For analytic epi or analytic epidemiology, we test a specific hypothesis about the relationship of a disease to a specific cause by conducting an epidemiologic study that relates the exposure of interest to the outcome of interest to establish a cause and effect relationship. And the typical study design in analytic epidemiology is cohort, case control, or the experimental design. Okay.